Time now to ask it early. Medical correspondent Dr. Jennifer Ashton is here, and today she's answering your questions on everything from belly fat to bad headaches. Josh, good morning to you.
Good morning, Jeff.
I want to start with a question that a lot of parents have of young kids. They may have a question similar to what Ricardo's mother is asking this morning.
My 6-year-old son has asthma. My doctor says he will outgrow it. How likely is that?
That would, of course, be Ricardo's father.
Right. Well, listen, no parent.
The question stays.
No parent wants to hear that their child has a potentially chronic illness like asthma. It's incredibly common. They're not alone. 7 million children in this country suffer from asthma, resulting in just over 14 million missed days of school each year. Really, the key is knowing what's causing the asthma. A lot of times, multiple factors can be at play. If you have a child who has some wheezing or reactive airway disease after an illness like a flu or upper respiratory illness, much greater likelihood that it will go away. The key, especially this time of year, Jeff, is having some steps in place so if they suffer an asthma attack, you are ready. Basic things. Number one, you want to schedule them a checkup with their allergist before they go back to school. Make sure they have their appropriate medications. Have an asthma action plan in place so the child and those taking care of that child know what to do if they have an attack. And it's always a good idea to meet with the school nurse and possibly the child's teachers so that you are prepared. Preparation is the key.
I suffered from asthma as a kid. It was awful at times.
Yeah,
and very
it really is.
For both kid and parent. Next question comes from Facebook, where Lisa writes, just started going to a gym. A personal trainer is not in the budget. What exercises will be most beneficial to regain core strength and reduce excess stomach weight?
Good for Lisa, first of all,
absolutely.
for going to the gym. You don't need to spend a lot of money on a trainer, but we have to distinguish here. Are you talking about the muffin top belly fat that you can actually see?
You did say
or,
that, didn't you?
Yes, I did,
Wow.
muffin top. Or, I think it's in the dictionary. Or are you talking about the belly fat or visceral fat that you can't see? Now, when you're talking about the muffin top, you need to eat well and you need to exercise. There's no other way about it. It's a simple equation. When you talk about internal fat, that dangerous belly fat, it's actually more important where it's located than how much you have. A recent study out of Duke University really showed that the key for removing that type of dangerous internal fat, aerobic exercise. The people who did strenuous cardio and a lot of it lost 67% more visceral or internal fat than those who just did core training or core and cardio.
At sort of a medium level for an extended period of time?
Yeah, you have to log in the hours. There's no other way around it, Jeff, but it's very important because that internal fat can lead to liver problems, metabolic syndrome, diabetes, very dangerous.
And she knows. This is a triathlon participant right here. Last question is for the 30 million Americans who get these type of headaches.
Hi, my name is Amy, and I suffer from chronic migraines. Wondering if diet and exercise could help those.
Diet and exercise can help a lot of chronic conditions, no question about it. The key with migraines, knowing what your triggers are. There are so many of them. Things like alcohol, aged cheese, caffeine, even certain food additives or processed meats. These are all the things that we should be eating in moderation or limited amounts anyway, but they definitely can precipitate migraines. If you know that's a trigger for you, obviously you want to avoid them. If your migraines are not well controlled, speak to your doctor about getting prescription medication, but we always try to recommend lifestyle behavioral modification first.
Very good stuff. Jen Ashton, thanks very much.
You betcha.